Well, the number of new COVID cases in Massachusetts continues to drop while the dangerous Delta variant continues to spread.
Here to answer your questions is Dr. Mark Seidner, epidemiologist within the Department of Infectious Diseases at Mass General Hospital. Doctor, thank you so much for joining us this morning. It has been exactly 2 weeks since the state lifted its COVID restrictions. Are you seeing any reason yet to roll back on the reopening?
As we reopened here in Massachusetts, all things really do continue to point towards improvement. Trends in cases, hospitalizations, deaths, as you mentioned, are all down and the lowest they've been since the epidemic began in this area. So I think things are looking good. On last check at Mass General, we have less than 10 cases in the hospital. That's down from hundreds a few months ago. What we're seeing, I think, is the combined effect of the vaccines working in warmer weather. So it's been good to see the virus on the run.
Wow, just 10, good indicator. Well, besides the hospital and on mass transit, are there any other locations or situations where you're still wearing a face mask, even when it's not required?
Well, as you know, there are a few places that you still need to be masking up, and that's healthcare centers, as you mentioned, schools, public transportation, congregate settings. But I think it's really important to remember that this is an individual decision for most people, and in large part because the vaccines aren't perfect in everyone. So if you're immunosuppressed, or maybe there's an immunosuppressed person in your household, you still may choose to mask up, both indoors and outdoors. And I remain a supporter of encouraging people who feel that way to keep themselves safe to do so anywhere they'd like to.
Let's talk about this new Delta variant. We know it spreads faster and it may cause more severe symptoms. Does the person need to worry about it if they are fully vaccinated?
Sure. So we're seeing this Delta variant in about 10% of cases that are being sequenced here in the Northeast. So it is around. But a study out this week took people who've been vaccinated actually against the Pfizer vaccine. It took their blood and looked to see if the antibodies in their blood killed the virus. What that study basically showed was that these vaccines do protect us from these variants, although not quite as well as the original virus. They do kill the virus. And so I think if you're vaccinated, you should feel that you're as safe as possible to be protected against this new variant. On the other hand, if you're not vaccinated, in case you still needed a reason to get vaccinated, as you mentioned, this strain is more contagious, it's more severe, and these vaccines will protect you.
Absolutely. And as you know, there is no vaccine authorized yet for children under 12. What's their risk right now from that Delta variant?
Yeah, so two things put us at risk for infection. It's how much exposure we have and how we're protecting ourselves. At the moment in this area, the virus is quite rare. And so in that sense, actually, people are quite protected from infection. But on the other hand, unvaccinated people remain at risk. It is still circulating. And so to protect everyone, children and unvaccinated people do need to continue to wear masks and practice hygiene. But of course, the good news here is that we're studying these vaccines in younger people. And it looks like in kids as young as 6 years old, we might have vaccines authorized by the end of the summer, and as young as 6 months old by the end of the year. So for the little ones out there trying to get their masks off for good, I think there is good news coming. And I know, at least for my children, that day can't come soon enough.
Okay, Dr. Mark Seidner with Mass General Hospital, thank you so much for joining us this morning.